Good evening. Thank you for everyone for attending our webinar. We'll be starting in about 1 minute. We're just waiting for a few attendees to get into our webinar. Thank you. Thank you everyone for joining with us tonight. Validation in DBT and beyond. The partners of understanding the emotional life of our clients, your loved ones, and yourself with Dr. Amanda Uliaszek. So Amanda is Associate Professor in the Department of Psychological Clinical Science at the University of Toronto, where she's been the director of the Personality, Psychopathology, and Psychotherapy Lab. And today I'm with the Ashley Book of Mindfulness Foundation. For those who are not familiar with our foundation, we work to improve the quality of life for individuals impacted by emotion dysregulation. We also support our educational service for loved ones and increase community awareness about mental health. And to learn more about us, you can visit us at www.abmf.charity. So just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the Q&A box. It's located at the bottom of your Zoom control panel, and we'll forward your questions to Amanda for her to answer at the end of her presentation. So today with me, let's welcome our presenter, Amanda, and we're honored to have you here with us today. At this time, I'm going to throw it over to you.
Hey, great, thanks. Hi, everybody. If you're watching this live tonight, or if you're going to watch it later on, I welcome you and I thank you for your attention and your willingness to participate and maybe hear something new or be reminded of some things that maybe you forgot about or you want to start using more. So I'm going to challenge you right now to start thinking about how you understand your loved ones. So think about the things that get in the way. And if you're a clinician watching this, things that get in the way of you understanding your client. So take a second and do that, and I'm going to set up the presentation. So I'm going to get started. So thank you for that introduction. I am a clinical psychologist. I've been a professor for 10 years, and I study borderline personality disorder, emotion dysregulation. I'm also a DBT clinician mainly. And so today, what we're going to be talking about is validation. And now this is going to be a deep dive into what validation is. It is by no means specific to DBT, dialectical behavior therapy, but is used by all kinds of therapy and can be used in your day-to-day life all the time, and is especially important if you or a loved one is dealing with significant emotion dysregulation or symptoms of borderline personality disorder. Okay, so we will get going. My goal and my intention today is to provide you with some tips and tricks and give you lots of examples to show how I might, as a clinician, as a friend, as a loved one, as a parent, might use these validation skills. Okay, so I'm going to start out by kind of going through a series of examples. And we're going to keep these examples in our mind as we go through this presentation. So I want you to kind of have an open mind and think, if this situation was happening to you, what is your knee-jerk response? How do you respond right away? Okay. So when you are feeling dysregulated, your loved one says to you, I can't take your mood swings anymore. You're awful to be around. How do you respond to that? Your child says, I hate school so much. If you make me go, I'm never talking to you again. How do you respond to that? You have a screaming match with your partner and you spend the next day thinking, what is wrong with me? Why do I act so crazy all the time? How does that make you feel? How do you respond to that? Your loved one says, I've been so overwhelmed and depressed lately that I've been cutting myself and it's been helping and I'm not going to stop. And then if you are a clinician on this presentation, your client says, I'm constantly worried my girlfriend is going to leave me. I'll die if she does. So in all these instances, someone is having an experience, an inner experience, They are having a thought, an emotion, they're doing something, and you have this chance to decide, how am I going to respond to this? What am I going to do next? We have our knee-jerk reactions, but then we also have the chance here to think about, if I were to respond thoughtfully and I took my time, what would be a good way for me to respond to help this person and help our relationship? And that's what we're going to be talking about today. Okay, so you might be thinking, if you're in this, you're listening to this webinar, but, why do I have to understand how the other person feels? Why do I have to put myself in their shoes? What if I am right and they are wrong? Don't I get to have a screaming match? Don't I get to tell them what to do? Don't I get to say what's right so they see my side? Yes. And as we say in DBT, both and those things. So what I want you to do today, remember, we're just talking about one specific strategy. There are other things you can do, and there are times when those other things are going to be helpful. But right now, I want you to kind of dissolve the idea of, I'm on my side, they're on their side, they're crazy, they don't know what they're doing, and I'm the calm one, and so what I say should go. We're going to dissolve that, and we're really going to imagine, what is it like to be in their shoes? And I know that sounds cliche. Oh, imagine yourself in the other person's shoes. But how often do we take the time to really do that and to do it accurately and communicate it? We don't do it enough. And so really that's what we're talking about here. What can I understand things from their perspective? Can I work towards that? And yes, and when I say work towards it, it is work. But this is what we're going to talk about today. Now, of course, the very first thing we're going to say is what not to do, or some of the behaviors that might be getting us in trouble in relationships, and that's invalidation. So we're going to first set up kind of like, what's the opposite of what we're after, or what's one way to think of the opposite. Now, I do want to say that invalidation is not necessarily bad. There is a time and place for every kind of interaction. There's a time when we invalidate the valid, as we say in DBT, and that's a good strategy for someone. That's not where we're focusing today, okay? We're going to talk about the likely consequences of invalidation and how that, especially for somebody that's struggling with emotion dysregulation, how that can be especially painful for them to handle. Okay, so we're going to talk about what invalidation is, clearly. We're going to talk about, quote unquote, why is it so bad? Nothing is really bad, but what are some of the negative consequences it can have for certain people? And we're going to say, you might ask yourself, well, am I doing this? I will answer that actually right now, and the answer is yes, you are. We all invalidate sometimes. I probably invalidated 5 times today with my kids, right? We say stuff to people where we unknowingly, or sometimes it doesn't hurt, to invalidate their emotional experience, to communicate in a way that says, well, how you're feeling right now, it's really not that big of a deal, or it's not that bad, or you're actually wrong with how you're responding. We do that a lot, and it's very innocent often. So yes, you are doing it, and so let's see if we can try to understand it more together and figure out a way to do it less. So invalidation, what is it? It is when a person receives communication, and I'm going to pause on communication because that's really what we're talking about here, how to communicate. When a person receives communication that internal experiences are insignificant, incorrect, or inappropriate. Okay? And again, by internal experiences, I mean emotions, values, thoughts. So when someone is telling you what you're feeling is not the right feeling, or it's too much, or you shouldn't have any feelings at all, that is what invalidation means. And again, if you've invalidated, it doesn't mean you're a bad person. It means we do this often. So I'm going to give you some examples that I already brought up. Your child says, I hate school so much. If you make me go, I'll never speak to you again. And you say, no, honey, school's not that bad. You just had a bad day. Now that's very kind sounding. It has the intention of being helpful, but I've just communicated to my child, her emotional reaction is not the appropriate one, that she's overreacting, even though I'm just trying to soothe. Your loved one says, I'm cutting myself, it's been helpful, I'm not stopping, and you say, please don't do that. It is not the way to deal with your emotions. It's not a good idea. Now you care, that's your view, but you are communicating that that strategy and that emotional pain does not warrant that behavior, right? Your client says, I'm constantly worried, I'll die if she does. Now, in a cognitive behavioral therapy tradition, which I am also do and very supportive of, my first thing I would do as a cognitive behavior therapist is say, that thought, that's a distorted thought. We're going to challenge that and change it. So communicating to the client, you're not actually having the right thought. We need to change your thoughts. Now, for some people, when the emotion level is low, they're not particularly emotionally sensitive. These kind of statements are fine. They don't bother them. They can just roll with them. For those of you that have loved ones or are a person with high levels of emotion dysregulation, you might start to understand why that can be really damaging. For someone whose emotions can feel out of control anyway, communicating to them that your emotions are wrong, it can lead to someone feeling even more confused, more erratic, more out of control. Okay. So again, invalidation doesn't mean you're a bad parent or a bad therapist or a bad friend. We all do this kind of thing, but for certain people in certain situations, it can be really, really damaging. And so what does it do? So let's say it is one of those situations, right? It is someone who is particularly sensitive to invalidation, or even not. Well, I'll tell you very fast. Earlier today, I said to my husband, I'm nervous about this webinar. It's later tonight. I'm a little bit nervous. And he goes, oh, you don't need to be nervous. You know what you're talking about. And my initial response was, no, but you don't understand. Let me now convince you of why I should be nervous. That is the natural response to invalidation. When someone says, no, you're fine, often when something's important to you, you'll say, no, let me explain why I should be nervous. There's a lot of people that signed up. And I then laughed and I was like, let me tell you about what the talk is that I'm doing. I'll teach you a little bit of validating behavior. So really what happens often when someone is invalidated, and imagine if they're at very, very high level emotion state, what actually happens is the negative emotions increase. So when you're giving advice, you're telling someone what to do, you're telling them it's really not that big of a deal, you're overreacting, calm down, the negative emotions tend to increase, which is like the exact opposite of what you want. Now, what also happens during chronic invalidation or in a particularly invalidating relationship, the person develops protective behaviors that can often be maladaptive. So the person might immediately start yelling and screaming, or they might go to threatening or self-harm. So they are going to justify to you why their emotion is valid. They're going to show you. And this we have seen, and we've talked about it in other webinars about borderline personality disorder. When we look at childhood and early childhood environments, sometimes we see very caring and loving parents, but there's a pattern of invalidation. And for someone who's born naturally very sensitive to emotional stimuli, what happens is they develop these protective behaviors to really show and broadcast, this is my emotion, and this is, now you know I need help and I'm serious. Okay, and it's not on purpose, but it's how things start to develop. And then we have the last kind of problem with chronic invalidation is the person can stop trusting their own experience. So not only are they feeling heightened levels of negative affect, they may be doing these kind of defensive behaviors in response to invalidation, but they really start to think about well, I don't even know I can't even label my own emotion. I don't even know what I'm saying or doing. And it starts to feel very out of control to them as well. So too fast. So again, if you think about you're feeling stressed and kind of upset, and you say to your loved one, and your loved one says to you, I can't take your mood swings anymore. You're awful to be around. Well, that is very invalidating to you. But the urge then is to invalidate that right back, right? The urge is to be like, no, you're terrible to be around and you do all this stuff. And let me tell you why I'm upset even more. And all it does is escalate that argument, right? And you might say, oh, I'm supposed to validate my partner when he or she says that. Yeah, that is one way we're going to talk about how to de-escalate an argument like that. So if you're still thinking, I don't know, am I invalidating sometimes? Here's some classic signs that you're invalidating. You're telling someone what their emotional response should be. And I hope if you take something home today, you realize there is no should when it comes to emotions. That is an individual experience, and our emotions are valid. It doesn't matter if you wouldn't have had the same emotional experience, or 99% of the population wouldn't have. The person's emotions are the person's emotions. So we can always validate them. They're always real, even if you think they were triggered inappropriately or the consequences of them, the behaviors that follow are inappropriate, we can still validate the emotion. So we want to avoid instructing people on what they should be feeling. So if you're saying things like, you need to calm down, there's no reason to feel that way, you're overreacting, those are surefire ways to increase a negative emotional response when you're really trying to decrease it. The second thing is if you're giving advice as the immediate response to someone's emotional pain. So instead of first validating that their pain is real, that it's valid, that it makes sense within their context of life, if you jump into like, okay, here's what you need to do, you can be communicating that, well, they couldn't figure it out on their own, that you know better. And as a clinician, as a psychologist, we sometimes fall into that path of, well, I know some good techniques. I know how to help you, before we forget to say, wow, you must be in a lot of pain right now to feel like this is your only option, is to hurt yourself, right? We have to slow down as clinicians, as loved ones, and say, before I make changes, before I scramble to figure out what's the next thing I need to do to have a better life or to help, how can I just validate that this emotional pain exists? How can I just, give it like a little bit of honor and time to say, yes, it is there, and we're going to try to fix it. So that's the dialectic, right? We accept that the pain exists and it's real, and we're going to try to change it. We're going to do both of those things, even though they seem like opposites, because there's a kernel of truth in both sides. Okay, so now validation, we'll get to the actual, okay, well, what do I do instead? How do I know how to validate? How do I know what to do when I'm confronted with these kind of examples? And so for validation, we're going to talk about who is it? Who am I validating exactly? Well, I'll tell you this, you can validate anybody and anyone would appreciate it, I'm sure. It could be an acquaintance. It could be when you're on the phone with Rogers. It can be, your mail carrier, whoever, just to be like, hey, it looks like you're having a hard day. Some people just sometimes need to hear that. All the way to someone struggling with mental illness. The validation is just, it's using empathy to connect. And so really when I say who is this for, you can use it in all sorts of situations. So there really is no limit. And that's why whether you're a clinician watching this or someone else, like all of these tools apply across the board. Then I'm going to talk a little bit about when is the best time to use it, because you don't walk around doing this in all 24 hours a day. It's a lot of work and it's not always necessary, right? I'm going to tell you obviously what it is at some point. and then why it's helpful. Okay. Great. Okay, so when should I use validation? So if you're struggling a little bit, I'm like, how do I integrate this into this one relationship I'm thinking of, or with a client, or we are going to talk about with myself, so you can, because you can self-validate. When you are confronted with someone who is emotionally dysregulated and or experiencing high levels of negative emotion. So when someone's at a 7 out of 10 or higher, and by emotionally dysregulated, I just mean someone whose emotions feel really out of control, where there's a high likelihood that some kind of maladaptive, harmful behavior is going to follow, whether that's, drinking too much alcohol, self-harming, yelling and screaming, quitting a job, avoiding, whatever. It's when someone's in that state where they start to almost make like difficult decisions. Okay, so if someone's talking to you about that kind of thing and that's what they're bringing to the table, this is a good time to definitely at least start with validation. Okay. The second place where this might be a good idea is if you're wanting to encourage someone to use or try a skillful behavior. So if you know your friend, your family member, your client has recently started practicing mindfulness, or calls a certain help number, or does thought records for cognitive therapy, if you know they have a skillful behavior, those behaviors get really hard to use when you are feeling very emotional, right? And so if you're, instead of telling someone, hey, you're supposed to be doing X, Y, or Z when you get upset, you should go do that. That can be invalidating. You're not stopping to recognize that the pain is real and potent and upsetting. So to take a second before you encourage skillful behavior to say, let me understand you more. Let's talk a minute about where you're at right now, because I want to see your pain. I want to recognize that. And lastly, you should use this whenever you want to build a good relationship. It really is relationship building validation. So in DBT, we talk about the give skill as a way to build relationships. So being gentle, acting interested, validate, and using an easy manner. And so obviously validate is a very important part of that. So if these are things you're trying to rebuild or build a relationship, if you're trying to get someone to use some kind of new skills, or if you're just, someone is coming to you with a lot of emotion and it feels a bit overwhelming, this is a good kind of entry into that conversation and into that interaction is validation. So what is it? So that's just a quote down there from Alan Frusetti and Marshall Linehan. So the expression of a genuine understanding of a person's experience and how that experience makes sense. So we really, again, are saying that the person's experience is legitimate. We are not saying that trying to harm yourself is legitimate and a good idea. We are not saying that screaming and yelling and cursing at me is a good idea and legitimate. We are saying that the pain, the emotion that's driving it is legitimate. And it makes sense that you're struggling. And that's why you're doing these kinds of things that are making things worse, because you have so much pain. So I'm going to repeat this kind of sentiment over the next 2 or 3 slides, because I think the common response is like, yeah, but people, when someone does something so crazy or someone does something so awful, how can I validate that? Well, you can, because we can evaluate the emotion underneath it all. And I'm going to give you a lot of examples on that. Okay. So we underline it too. So what should this validation look like? When I'm communicating my validation, what am I doing? So I want to be accurate. So if you're saying, hey, it looks like you are blah, 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 and you're totally off base, that's not really going to help the situation. It might confuse the person for a second, but it's not going to make things de-escalate. So you need to be accurate. You need to spend some work and some time a little bit figuring out what's going on. You need to be genuine. So when you're validating, you're not rolling your eyes, you're not saying it sarcastically or passive aggressively. Oh, you must be angry again. I see you're angry. That you need to genuinely show that care and that connection, that empathic connection. And you need to be emotionally evocative. So as you're validating, and I'm going to go through again this in detail, you really want to be targeting the emotion. That becomes what is potent and useful as you're validating and connecting and building these relationships and allowing someone to feel heard. So if we take one of our examples that we've been throwing around, this one is hard, right? I'm having an upsetting day. I say to my partner that I'm having an upsetting day, and he says back to me, I can't take your mood swings anymore. You're awful to be around. Okay, so let's try to validate that. So I might say something like, I think that maybe the way I'm communicating is making you feel frustrated. I can see that it might be exhausting when I'm feeling emotional. I'm guessing maybe underneath it all, you're feeling a bit scared, or maybe you're even feeling hopeless as well. And I feel that too, and I'm sorry for that. So right there, what I did was I pointed out the emotion I was hearing. I also went a little bit deeper and made some guesses. Maybe, are you also feeling hopeless? Because I do. Are you feeling frustrated? I am. And so I'm connecting and I'm bringing out the emotion. I'm not defending. I'm not commenting on the fact that him saying you're awful to be around is not a helpful way to communicate, and that he's the one doing the invalidation, but I'm using validation to de-escalate the situation. So communication opens up and problems can be solved. So first I'm going to take it down more simple, and then I'm going to take it more specific. So this is the simple diagram of what validation is. We have an experience. That's this first part, an internal experience. It can be another person, the client. It could be yourself. You could have the experience because we can self-validate. The second part, you need to understand the experience from the other's perspective. You have to. You have to have empathy. And empathy is getting down in it and feeling the pain the other person's feeling, recognizing it, seeing it. It's not, oh, I feel bad for you, like you seem to be struggling. That's sympathy, that's different. You really have to look and see where the person's at and say, I think this is where you're coming from. Am I right? How is it? You got to feel that first. So if you're thinking to yourself, there's a person in your life you'd like to try validation, but it's really hard for you to connect with them. Or maybe you think, when you think about them, it makes you angry or closed off. That's something for you to start thinking about. Where can I see the humanity in them? Where can I make that connection? And where can I start to think about things from their perspective? The last part is you have to say it to the other person. That's the validation piece. So you have, something happens, you have to understand, and then you have to tell them. Okay. So if we go into the levels of validation from dialectical behavior therapy, what this is going to give you all is a little bit more details in terms of the exact way that you might validate someone. So I'm going to go through these levels. And the first level is the easiest, and they get progressively more difficult and more work to do as you go down the list. Okay. If you can do absolutely nothing else, pay attention to them, listen to them. Don't be on your phone, don't roll your eyes, don't do other things. When someone comes to you in emotional pain, you pay attention to them and you listen to them, even if you don't know what to say. That right there is you're beginning, you're validating them. You're recognizing them as a human being. Next, if you can, accurately reflect back what they just told you. Okay, this is, for those of you that are not clinicians, this is like therapist 101, right? This is what they teach us on the first day. So, okay, what I'm hearing you say is that you are extremely anxious about your girlfriend leaving you, and that's making you think of what would happen if she left. So I know nothing else. I am just repeating back what the person just told me. Okay, so you can do, okay, so, and you can use our little sound bites. It sounds like you're saying, if I'm hearing you correctly and you're just repeating it. Okay, let's say you can go a bit deeper. Perhaps you can start to validate someone on a deeper level where you're actually labeling for them non-verbalized or unobserved things, right? And so this can be particularly helpful with someone maybe who has mental illness or high levels of distress. It's hard for them to actually even know and put words to what's going on. Maybe it's so fast or it's so extreme or it changes so suddenly. But if you can help them try on a hypothesis, so you can say, hey, I'm guessing, is this going on? I'm not telling you it is, but it sounds like to me, for example, in the example we have here on the screen, it sounds like you think your girlfriend is the only important thing in your whole life. And if she left, your life wouldn't be worth it anymore. Is that kind of underlying this? So what we're doing is we're kind of going a bit deeper and getting more to the core of the emotional experience. Then we have understanding in terms of previous learning. And all this is kind of saying something like, yes, based on the experiences you had with your last girlfriend, this makes a lot of sense that you're feeling this way. Based on your childhood, based on your last relationship, based on how things are at work. So you're bringing to the person the fact that you know them, and even though their behavior might not be agreeable, it might be destructive and dangerous, even in some cases, you're saying, but I know why you're doing that. Because of what's happened to you, I get it. So I see you're in pain. I understand why you did it. I don't agree. I don't think you should do that. But I get where you're coming from. That can be very powerful. 5 is, if you can you normalize it? Say, you're right. Anyone in a similar situation is going to do the same thing and feel the same way. So this doesn't always apply, but sometimes it does, right? Now, radical genuineness. So, people with mental illness they might be used to being treated as broken or fragile or even manipulative, and they may be approached by therapists or their parents or their partners as, I can't let my guard down with him or her, right? I never show any of my vulnerability because, he or she can't handle it. This is a time where you just get down in it. You put aside your therapist role, you put aside your parent role, and you just treat them like a person in pain. So you might say, wow, it anguishes me that you feel like this. I can just see your pain, and it is so hard for me to see that. It's just really hard. This might be a time where you yourself are crying because you're connecting, or you're really getting in there with the person, experiencing what they are. Last thing is self-disclosure. And that just means you might have experienced something like this. You might have had times in your life where your negative emotions were overwhelming, but you've never told anyone, or you've never told that person. And if it's appropriate and helpful, that could be a great way to validate, to say, I never told you this, but there was one time in my life where I felt like this too. And it was so much pain. I never thought it would end. Is that how you're feeling? I know it was really hard for me at the time. So we have all these different ways that you can validate the emotions. Any of these things would work. But the more connected, the more you demonstrate your knowing of the person, the more powerful it can be. And so again, I want to emphasize that any interaction is going to have components of values, thoughts, judgments, assumptions, behaviors. And we really want to focus on the emotion. Of course, you can validate thoughts. You can validate, say, yeah, I get why you're thinking that. That makes sense. Or I get why you did that. Those can sometimes be harder to validate, especially when someone is doing very dysfunctional behaviors. But the emotion is always true. So if we can get back to the emotion, we usually can do a good job validating at that level. So again, I've been so overwhelmed and depressed lately that I've been cutting myself, and it's been helping. I'm not going to stop. So a validation, you're not going to say, oh, that's a good idea, it makes sense, you should keep cutting yourself. That's not what we're talking about with validation. We're not agreeing with dysfunctional behaviors or dangerous behaviors or self-damaging behaviors or other damaging behaviors. But we can clearly validate, you must be in so much pain to feel the need to harm yourself. Or there was a time where I was feeling extremely overwhelmed and depressed. Tell me more about what you're going through, right? So we can focus in on that emotional pain and validate that. It does not mean we agree with the rest of what the person is doing, or we're going to encourage it. So a few tips and tricks before we kind of wrap up. There, and like I just said, there may be parts of the experience that are valid and parts that are not. And so we remember, Kelly Korner, who's a well-known DBT clinician, I heard her speak once, and she talked about listening for the waterfall in the windstorm. So someone's coming in, they're raging, screaming, yelling, they're saying all this stuff to you. It's very overwhelming. Can you, tilt your head and listen for the waterfall when all the debris is flying and the wind is blowing? The waterfall is the emotion. So what is that emotion that's driving this behavior? What is it that I can listen for and say, hey, you're scared right now, or it sounds like you're having a lot of shame. Is that right? Is that what I'm hearing through this? If you can dive in on that emotion, then you're really able to connect, and it's going to dampen the negative emotion. So emotions are always valid. I already said that. The other thing is find the person's location. It's a location perspective, right? You have to know where a person is coming from. You need that to develop empathy and then to communicate that empathy. So you need to find their location. If you're just really want to help and you really want to give advice, you can't give them directions until you know where they're coming from, right? You can't give direction if you don't know where they're at. Like, you couldn't give a lost person directions if you don't know where they're coming from or where they're going. So what we need to do is think, okay, what if I can trace this back and figure this out? Like, there must be something going on. I don't need to respond to what's just in front of me. Let me bring in everything I know. Okay, that's so, so important. So again, validation is not agreement. It's not sympathy, which is feeling bad. If you feel bad about someone's situation, I don't need to know their emotions. It looks like what you're going through is hard. I don't like that. I feel sorry for you. That's not what we're talking about. That often makes people feel diminished when you say, oh, I feel really bad for you. I feel really sorry for you. So again, if you're talking to a caregiver of someone with mental illness, saying, oh, it's probably not so bad, you're going to be fine, your child, husband, whoever is going to pull through, again, that's invalidating, right? It's telling them their emotional response is incorrect. But also saying, oh my God, I feel so bad for you. It must be so awful to be doing what you're doing. That again is not quite validation, that's sympathy. So we want to say, wow, you must be feeling a lot of frustration, but also a lot of anxiety. Is that what it's like on a day-to-day? Tell me more about it. That's where we want to go when we're trying to support somebody. And finally, what happens when you validate someone? So we know from psychophysiological studies where you hook people up to heart rate monitors and skin conductance, if you validate someone, it calms their physiological response to a negative emotional stimuli. So it's going to soothe them if you do this correctly, right? It's going to elicit more adaptive behavior. So if you're a clinician, what we want to do is have validation precede and encourage change-oriented strategies. So if I have a client, I really want them to be practicing skills, for example. But when I validate first and I make an effort to be empathic and see where they're at and talk about that and say, yeah, what you're doing makes sense, and now I need you to make changes, that's going to make things better for everybody. And it's going to elicit those adaptive behaviors instead of, remember, pulling for those maladaptive behaviors, which is what invalidation does. And again, it improves relationships, right? So improves therapeutic alliance, if this is a therapy relationship or just any kind of relationship in general. So again, this situation again with the partner, we already talked about when you validate the partner who's mad at you, you actually pull for open communication and problem solving, right? When we're talking to someone who's so overwhelmed that they feel like harming themselves, when we validate that, it doesn't pull for that. I'm going to really show you how, messed up my life is. I'm going to justify this choice to you. It doesn't pull for that. It soothes, it calms. And the same thing with your child. If you say, in this case, wow, you must be really struggling with something at school. That has to be so hard. I can imagine. When I was a kid, I remember those days where I didn't want to go to school. It felt like torture. I get it. That's going to build your trust. It's going to build your bond. And so these are the kind of the things that people say, but how can you validate a white supremacist, or how can you validate someone who abuses people? Again, it is very, very hard to do that when you strongly disagree with someone's morals, ethics, behaviors. But what we're going to try some of our levels of validation, right? So if someone has really strong values, very different than yours politically, religiously, you might say, yeah, lots of people actually agree with your beliefs. So, okay. Or you seem really angry right now. That can be really frustrating, right? Maybe if I had your history, if I had gone through what you went through, I might have the same beliefs as you. So you can actually say, to try to put things in context of past learning, normalizing, or just reflecting back when someone is bringing you real strong beliefs that you don't agree with. What about when someone discloses their mental illness to you? Remember, we want to avoid sympathy. We don't want to be like, oh my God, I feel so bad for you. That sounds awful. Because then again, we're diminishing them, right? And again, we don't want to invalidate. I'm sure it's not as bad as you're saying. I'm sure you'll be fine. I'm sure you'll snap out of it. This won't last forever. All of those things. Instead, again, open listening, accurately reflect back what they're telling you. Wow, so you've been diagnosed with borderline personality disorder? I know that comes with a lot of really painful emotions. Is that what you've experienced so far? Be interested, be kind. Understand what that must be like at the moment for someone telling you that. That I bet this was really hard for you to bring up. Thank you for doing that, trusting me with that information. It was probably really difficult for you to talk about with me. Or was it? I'm guessing this might have been really difficult. What were you worried about when you brought it up? Ask those questions. Reflect back. Think about what it must be like in their shoes, instead of thinking, oh my God, I'm uncomfortable. I don't know what to do. I want this to end and I'm going to just kind of brush it away. That's not a way to connect. Caregiver, we just talked about. And what about a client who becomes dysregulated when you push for change? Again, we want to validate that dysregulation. Change is really hard. It is so much easier to keep doing what we're doing our patterns. So I appreciate even the fact that you're willing to entertain it. So we want to, again, just validate. And again, all of these things I talked about works on you too. So, when have you made a mistake or done something wrong and then sat and judged yourself for it? Does that help you feel more motivated to do better next time? It generally does not. So sometimes people, our own selves, talk about how what we're thinking and feeling makes sense in a certain context. That's my next point, actually. It's not about justifying your, quote unquote, bad behavior. If you did something wrong, what you want to do is self-validate where that pain came from, have some acceptance around it, and then you can make amends. You can apologize. You're telling where this emotional pain came from. And for clinicians, the more you validate, and this is true, I guess, for everybody, the more you validate someone, the more they're going to be able to start to model that on their own. So in summary, if you remember nothing else, find the kernel of truth in the other person's experience And I say, listen and locate. So listen to what they're saying to you and locate their experience. Figure out where they're coming from and seeing if you can't communicate those two things back to them. And if you can't, you don't get it, it's too much, pay attention to them and treat them like a human that's in pain. Okay? Avoid giving advice right away, judging, sympathy, and always jumping.
Let's jump to the Q&A session then. We have a few questions here. So just a reminder, if you do have any questions, type them into the Q&A box at the bottom of the control panel. And we'll try to get to everyone's questions. And Alicia, are you there?
Yes, hello. Sorry, I just wanted to send a quick message to everybody. And I've answered this question a couple of times in the chat. Yes, a recording of the webinar will be uploaded to the ABMF website, and Amanda will provide us with a copy of the presentation that will be emailed out to all registrants. So not to worry about that. If for any reason within a week or so, if you don't receive a copy of the presentation or you don't see an uploaded video, just reach out to us at info@abmf.charity and we'll get back to you.
Great, thank you.
So our first question, we have a lot of good questions here. So our first question is regarding validation, and if this is right for them. So they ask, is this okay? Is this, I guess, the topic okay for someone with BPD that hates their diagnosis and thinks it's the end of the world?
So I will just put it out there that I hate the BPD diagnosis. I often don't think that it's very informative for people. So if someone has a diagnosis of BPD and they hate that diagnosis, I can't imagine a reason why you would need to talk to them about it or bring it up in that context. So instead, think about the individuality in the person with BPD. So what are they specifically experiencing? Are they feeling emptiness inside? Are they feeling uncontrollable anger? Are they having identity issues? Can you validate that? You never have to say the word borderline personality disorder. You never have to say that, especially if they hate it. Or you can validate that. Diagnoses can be really hard to deal with. They really put a label on you and it doesn't accurately describe everybody. So we don't even, I get that you don't like it, so we don't even have to use that word. I'd rather just talk about your experience. I hope I answered that correctly, I think.
That's great. Thank you so much. So our next question is, how does one navigate one's adult years if one has had a major part of their childhood that has been invalidated, particularly for someone who is an HSP?
Yeah, so, a lot of people for sure are struggling with the fact that they spent years in child parent or caregiver or partner or friend, even relationships where they were continually invalidated. Sometimes it's called, it could be invalidation through neglect or gaslighting. Part of that is how you can start to use self-validation as an adult. So that might be your place to start. Where if you're having emotion dysregulation right now, or you're doing behaviors right now that you then feel shamed of or guilty or stressed, if you're able to validate yourself and put it in the context, I spent years of my life not getting appropriate communication about my emotions. So this is hard for me right now, and that's okay. And I'm going to keep trying to understand myself, and I'm going to keep working on it. Then I'm going to be able to make the changes that I need, for sure. But that might be a good place to start, is with, how do I validate myself? How do I understand my own emotions now in the context of my childhood experiences, is the way I remember them. Yeah.
That's great. Thank you. Okay, so what do you do when your loved one internalizes their thoughts, so it is very hard to validate when you don't know what they're actually thinking or feeling?
Oh, that's such a great question, right? Because sometimes you really don't, they're not sharing anything with you, right? So that might be a time where you're still being open, alert, honest, you're ready to receive it, letting them know I'm here for you. Especially this can be true of like teenagers or kids. So saying, I know that I'm not hearing from you exactly what's going on, but I'm ready and I'm ready to listen when you're ready. So that's kind of our level 1 validation, right? But then if you know this person pretty well, if you know their history, you know their patterns, you know some of the things going on, think about their location. I kind of imagine like a compass, right? Okay, where are they coming from? And can I have them try on my hypothesis? So even if they're not telling you, if you say, you've been really quiet lately. Last time this happened, it was because there was a big stress at work. Like, I'm just wondering, is something stressing you out at work that you'd feel comfortable talking about? So it could be something like that where you're trying to verbalize the nonverbal.
Okay, great. Another question we have, is it a concern if I don't engage in a screaming match but withdraw and get silent?
I don't know what you mean exactly by a concern, but again, that is a type of behavior that can lead to more suffering, right? So I tend to use the example of, oh, screaming, yelling, violence, harm, because those are feel very obvious to people that that's what we're focusing on. But you may have behaviors you use when you're invalidated that involve avoidance, withdraw, stonewalling, which is you refuse, to talk about things. Those can be equally destructive in relationships for sure. So you have to kind of figure out where you are there. And if you find yourself going to that place, validate that, validate yourself, but see if you can't move to opening up maybe in little bits, and see if your partner can't be validating you as you open up.
Great. Um, so this one, I think this was in reference to a particular point of the presentation. So I apologize if I'm not exactly sure when it came in. So do you do a clarifying question to make sure you're accurate?
Oh, sure, you can. Absolutely. And so, it's one of those things that when you're in a conversation with someone, you're probably going to be doing some validation, some clarifying questions, some reinforcement, some praising, some change. So, like all of these different strategies can come into place. But I think in a lot of my examples, you picked up on it really well, that I would validate, but I would also ask a little bit about clarification. So, hey, does this sound right to you? Or can you tell me more about it? That absolutely keeps the conversation going and you'll learn more about their location.
Okay, perfect. Thank you. If one has never experienced validation, how does one model this behavior? I feel I have invalidated others. This is what I have known to negate someone else, almost implying that I know better.
Yeah, sure. And we all fall into these different kinds of patterns. So really it sounds like you're starting to recognize that in yourself. So you don't want to beat yourself up. Again, that's your emotional experience. I think sometimes when we see someone doing something and we feel like we know better, for some of us, it could almost make us feel like a little anxious or a little irritated, like we have to fix it. And so maybe you're experiencing something like that. So you feel that emotion, and the way you deal with it is by maybe telling someone what's a better way to go. So if you can start to recognize that and connect with that, all you have to do is start practicing to recognize that in yourself and try a different behavior. So you can say, okay, this is a little bit of a different skill. I'm labeling it, right? Okay, I'm feeling a little uncomfortable because I feel like I really want to tell that person whatever they're doing is kind of messed up. I'm going to breathe through that. I'm going to recognize it. And instead, I'm going to try to connect with what it is that they're experiencing. I'm going to try to understand them first, and then I can go and I can give my advice. But again, like I said at the very end, hopefully not cut out, because I have no idea when I cut out, is practice, practice, practice. You're going to make mistakes. Try. It might be a whole new frame of mind for you to really be putting yourself in another person's shoes. Just keep practicing and start with someone easy. Start with someone easy that you know really well, that you have a good relationship with. If you have that, that's a good place to start practice.
Okay, great. Um, I've been told that dialectical behavior therapy can be for people that don't fit in any other therapy. Is your experience with this generally true?
I think that DBT is for people who would benefit from new learning skills. So if you have a hard time using skillful behavior like emotion regulation or interpersonal skills, because your emotions get in the way. It's really hard for you to be skillful. DBT is great for that. And DBT is great for people that need focus and concentration and need to learn how to kind of calm things down and focus their attention. So yes, it's good for a range of different problems, especially those where there's behaviors that are getting out of hand and you need skillful things to replace them. It doesn't have to be for someone with a personality disorder. It doesn't have to be for severe depression. It works well across the board.
Great. You know what? I just looked at the bottom. I noticed the time is 8:02. So I don't know if you would like to, there's 22 more questions. So I don't want to take up all of your night. Would you be open to sending you these questions and then perhaps answering them on social media?
Oh yeah, sure. As long as you I'm not a good social media person, but if you give me instructions and yes.
Oh, we can even post it on your behalf if you don't mind. I don't want to take up too much of your time. And I know everyone was expecting this to end at 8 and there's like a lot of questions to go through.
100%. I'm so sorry for the technical issues. I know that like jammed us up for 5 minutes or so. So I'm so sorry about that. But I'm happy to answer questions if you want to kind of put them together for me, and you can, and I'm happy to answer them, and you guys can disseminate them however is easiest for you. And I can send you my slides as well if any of the people watching are interested in looking back over some of the details.
Okay, thank you. I'll pass it over to Trisha now.
I just want to say thank you for everyone for attending, and thank you, Amanda, for the great presentation about validation and the levels of validation and all the different perspectives. I personally took a lot from your presentation. So thank you for that. And we'll be sending a link again to the recording and the presentation materials to everyone in attendance. And feel free to email us any questions or comments. You can email it to programs@abmf.charity, which is in the chat box at the bottom. And you can also visit us at www.abmf.charity for any future events that are coming up. And again, as a new foundation, donations are important to help us facilitate future events and webinars such as this. So please visit our website, learn more about us, and we appreciate you all for being here. Be well, be safe, and we hope to have you with us again. Thank you again.